Gabe, and this is Taylor. And we're going to do so as a preface, you guys want to say we're going to do a lot of looking into the science, and there's a lot of statistics. So it can be like a little dense, but the whole point is to you guys value, right? So that you can provide that exact same value to your patients. So before we get into it, we have these 4 words here: to understand, educate, to inform, and to act. Okay, so as we go through all the information, it's a lot to digest. I just want you all to keep these 4 words at the front of your minds. And yeah, just be thinking about your future patients, right, or your patients in the clinic. All right, yeah, so let's get right into it. So mechanism of opioids. So in chiropractic circles, the term opioids typically has a bad reputation, right? We typically say like drugs are bad. So what do the opioids actually do? So within our body, we have these opioid receptors that are found throughout our nervous system with this highest density in the brainstem. So what the opioids actually do is they bind to the receptors, to the active sites of these receptors, and by doing so, they block the pain signals that are ascending towards the brain, okay, and thereby blocking that perception of pain that is perceived in the brain. So a question that a lot of patients might ask is, so are the opioids bad if they decrease pain? So I just want to throw that out there. If a patient asks you, okay, are they bad if they decrease pain? How would you answer that question? Just, yeah, anyone give me something? No. No. Okay. Okay. Yeah, so that's good. Yeah, for example, I've had a patient who was 10 out of 10 pain. He wants to play with his son, but he can't play with his son unless he takes the painkillers, those opioids. I wouldn't tell him, hey, you got to stop taking these because they're bad for you. Because again, our goal is to help our patients with their activities of daily living. It's reach the goals that they want to reach. So that wouldn't be the way that I would go about it. But do we offer something better? And I would say yes. Right. Yeah. So rather than talking about the opioids first, I want to talk about the nature of pain. So pain itself is a signal that the body uses to let the body know that there's an issue or there's something wrong. Okay, that's like the natural mechanism that happens in the body. So an example that can be used to compare, for example, we have a fire alarm, right? And the fire alarm is going off because there's a fire. So if I were to walk up to that fire alarm, I'm like, I'm just gonna take out these batteries. I don't have to worry about that loud noise. Yeah, everything's good. I would actually be pretty foolish. That's pretty stupid. Right. Yeah. So in the same way, exactly. Opioids can do something pretty similar along the lines in the sense that it can fool the body into thinking that it's okay. It's actually a condition called CIP syndrome. Has anyone heard of CIP? Congenital insensitivity to pain. So there are babies that are born who they cannot feel pain. So if they break a bone, they burn their finger on a stove, they don't actually know what's actually going on because they don't feel pain. And so these children actually have shorter lifespans because they lack that natural mechanism. Okay, so with all that said, with the nature of pain, there really is a purpose to why we have pain. Now, there can be problems with the pain pathway, and so that happens with chronic pain. So with chronic pain, it's actually been proven that you can have the pain persist even after the original cause of that pain. For example, the injured tissue has healed, that pain can still persist. And so there is a time and place for the dampening of pain. And so our body actually has natural painkillers that it produces. And so these are chemicals and neurotransmitters like the endorphins and enkephalin. Okay, and I'll talk a little bit more about these later, but they do the same thing. They bind to the opioid receptors, and by doing so, they stop that transmission of pain that is signal going up toward the brain. So with chronic pain, though, chronic opioid use is not the answer. Research has shown that with chronic and repetitive use of opioids, you actually have desensitization of tolerance. So what that actually means is that your ability to tolerate pain as well as there's a down regulation of the receptors, meaning there's less of these opioid receptors. And so it's pretty ironic that with the long-term use of these opioids, you actually will feel more pain in the long run. So that's pretty interesting. Now, question, these medications really help reduce my pain. How is chiropractic going to help? So I think the obvious answer is we aim to adjust the cause, right? So whatever the cause of that pain is. But I'd like to say that another thing, in terms of the pain pathway itself, with the chiropractic adjustic thrust, we not only have direct access to the nervous system and the spinal cord, but we also have direct access to the pain pathway. So I'm going to talk about 3 mechanisms that occur with the chiropractic adjustment. So these 3 are just 3 of a few. We don't have time to go through all these mechanisms, but I'll just quickly break down these 3 in very abbreviated format. So there's the stimulation of the descending inhibitory pain mechanism, there's a pain gating mechanism, and breakdown of joint capsule adhesion. So let's go into this first one. All right, so I got a pretty crazy looking diagram there. Don't get scared. Yeah. How do I do the light? Actually, I realize you can't really see. Yeah, the light is like you can see it. See that? Oh, there you go. You can see it? Yeah. All right. Okay, I hope people on Zoom can see it.
They can't see anything.
Okay, actually, I'll just use my finger.
Okay.
All right, so the descending inhibitory pain pathway. What is that, right? Yeah, so that literally is the activation or the stimulation of the periaqueductal gray matter here. Long word. Okay, and so there was a study done in 1977 where they actually placed electrodes on this area and they stimulated it and actually found that, so in cancer patients who had non-localized pain, so that means they couldn't tell where the pain was coming from, by stimulating that area with electrodes, they brought relief to these patients who had cancer. And how does that happen? So by stimulating the periaqueductal gray matter, you actually have a release of these natural painkillers that I talked about before. So that's the endorphins and the enkephalins. And so they work on the opioid receptors, as well as they attenuate a chemical called a substance P that is involved in pain. And so by doing that, it immediately, like, it decreases that sensation of pain like that. Now that whole mechanism of using the electrodes to stimulate this area is no longer used due to the risks that it could pose. And so that's no longer done. And the same with opioids. It actually does a very similar thing by stimulating this area. So it stops these signals with the green and red, the pattern, the passages, whatever you call these, like these pathways that travel up towards the brain. So that's the pain going up toward the brain, and it helps to inhibit that. So yeah, opioids will do the same thing, but they have to deal with the whole issue of desensitization that I talked about earlier. So with the chiropractic adjustment, we can do this with the adjustment in a way that poses almost no risk to the patient. And so that's one thing you want to be able to communicate to them, the immediate relief from pain by doing this. We're not trying to stick any electrode on them or anything. It's actually fairly conservative. Next one, pain gating theory. This one's a lot more common. A lot of you guys probably already learned about this in neuro classes. I'll break it down again. So you have the nociceptive fibers here. That's how pain travels. And mechanoreceptive fibers where the signals of a tactile sensation will travel to the spinal cord and up to the brain. So the nociceptive fibers are smaller in diameter. So that means the signal will travel a lot slower compared to the mechanoreceptive fibers that transmit the information a lot quicker. And so when this reaches this right here, this is called inhibitory interneuron that is activated and will inhibit the signal being sent from the nociceptive fibers. And so that's a lot taken. If you guys don't remember, don't know what that means. But so to break it down, it's like I stub my toe on this TV stand right here, and my toe is like, it hurts. And so basically, so that's the pain going up to the spinal cord, to the brain. But if I rub my toe, yeah, it feels a lot better because you have the activation of that inhibitory interneuron that blocks that signal of pain. And so again, with the chiropractic adjustment, what we do is by putting that adjustic thrust into the spine, the mechanoreceptors around the spine are actually stimulated, which immediately blocks that sensation of pain. So again, this is an immediate pain pathway.
Works, man. My wife, mom's kisses really help the pain go away.
Yeah. That's the right, and this last one is breakdown of joint adhesions. So with injury to the joint, there's the whole the cycle of inflammation. So you have inflammation, repair, and remodeling. Okay, so with pathological or abnormal remodeling, what happens is there's scarring at the area. So essentially, there's the fibrosis of repair. So the area becomes very fixated. It affects the nerves around. That can be impinged. And the muscles around actually will have a fatty deposition because they're not being used. Okay, so this mechanism, by adjusting the subluxation and everything around it with that whole fibrosis of repair, this actually helps with more long-term pain because there's constant movement that's restored. It restores the spinal nerve function, as well as restoring the function of those muscles that had previously undergone a fatty deposition. So this is more long-term way that the chiropractic adjustment can help with pain specifically. So I'm going to take a step back to the beginning of the opioid epidemic. Like, how do we get to where we are now? Because where we are now, obviously, we know there's, everyone is a big problem with the use of opioids. Okay, I'm going to bring it back to the 1990s. So there are pain advocacy groups that lobby to lift prohibition on opioids in chronic non-cancer pain patients. So at this time, the pharmaceutical companies were persuading the medical community that these opioids are actually not addictive. And so because of that, there was widespread prescription and use and distribution until obviously it became very clear, yes, they're addictive. And then we have to take that step back, right? But so dramatic liberalization of the use of opioids as well as no ceiling limit on dose was established. So I actually have a quote where it says, no disciplinary action will be taken against a practitioner based solely on the quantity and or frequency of opioids prescribed. Read that again. So no disciplinary action will be taken against a practitioner based solely on the quantity and or frequency of opioids prescribed. So basically at this time, a medical doctor could prescribe whatever the dosage of opioids to the patient for whatever frequency, and if the patient became addicted, there were no repercussions. So essentially there was no accountability. Not only was there no accountability, there was actually no evidence for the use of these opioids for long term. So they used randomized controlled trials, but the longest was no longer than a few months, and the majority of them were only up to 4 weeks. Yet they were giving out these painkillers and opioids. So 50% of patients taking opioids for 3 months and ended up still on opioids after 5 years. So there's really no reason for them to still be on that 5 years later. So no evidence, no accountability. I'm going to read this. Recommend against use of opioids for mild to moderate pain conditions such as chronic musculoskeletal conditions, headache, and fibromyalgia. So that was what was most commonly prescribed the opioids for. And a lot of these, I feel, chiropractic can help with these issues. Something to think about, right? So let's look at this long list. Yes, opioid drugs are linked to, oh man, like, look at this girl's face. She sees this, and there's a problem. Yeah, so basically, obviously we want our patients to know the side effects of all these drugs. And a few noteworthy ones I'm going to take a look at are infertility, immunosuppression, sleep disorder, breathing, death, confusion, depression, anxiety. This one's funny, increased sensitivity to pain. Very ironic. Yeah, that's very ironic. But so a lot of these pharmaceutical companies were trying their best to obviously limit these side effects, right? But obviously they can't limit that on everyone. And I'm going to bring it back to the nature of drug research. So the way they do trials for these drugs is they do these trials in very controlled and isolated environments to account for all the variables that can come into play, because they want the drugs to provide repeatable and repetitive results. The issue with this is by doing that, there's no way they can replicate the internal environment of a complex living being. And so that brings about an issue. When I say complex, I'm going to contrast that to complicated. So for example, like this laptop is pretty complicated in the sense that if I tried to take it apart, I wouldn't know how to put it back together because I'm
Yeah, like I can't. But it's complicated. But if you put like an input command into this laptop, you'll consistently get the same output command. Yeah, that's what I mean by complicated. So there's still a level of repeatability that happens with the laptop. It's like an HP laptop, right? So the same would be for Acer, Dell, MacBook. But when I talk about complexity, the complexity of the human being, there are just so many factors that cannot be taken into account. Yeah, so when you talk about these opioids, yes, they do help with pain, but you can't really control for all this, and so your patients need to know that. And so a synthetic drug like an opioid really can't compare to what I was talking about before, the fact that our body can create these natural painkillers, the endorphins, the enkephalins. And so that's just something to really think about. I'm gonna hand it off to Taylor.
Thank you, Gabe. All right. So you guys got to hear a lot about how opioids affect the body. So I'm going to start going into kind of the society aspect of opioids. All right. If you guys want, feel free to take notes. If not, don't worry. You guys can ask us and we'll share this PowerPoint with you, or we can share you a Google Doc that has some of the key stats that we found in our research. Right? So don't worry about it. All right, starting off. So these are some key stats that we found while we were looking at the impact of opioids. This is from 2015, but approximately 91.8 million US adults were using prescription opioids. If you think about that in contrast to the population of America, which is around 328 million, that's close to a third of the population that's under the use of opioid prescriptions, which is pretty insane when you compare it to the amount of people that are seeing chiropractors, which sits around 10%. So there's a vast majority of this population that's not seeing chiropractic care that could probably benefit a lot from it. Of this 91.8 million, 21 to 29% of them will likely misuse this drug. Of that 21 to 29%, 8 to 12 will likely develop a disorder because of it, and 4 to 6% of those will likely transition into using heroin. And we know heroin is probably one of the most addictive drugs out there with its own whole slew of side effects and issues. It was found that about 80% of those that are using heroin actually initially first started using prescription opioids. So this is a big sign that a lot of prescription opiates can be a gateway drug into using a lot of these stronger things. And that likely comes from the fact that you get desensitization after a while. So once those don't work for you as well, you start looking for something a little stronger. Another key fact, about 2 million US adults currently have a official misuse disorder. So that's a lot of people that have been severely impacted by opioids. A couple more key things in here. So I can't remember how recent this one is. I believe it's 2018, but about 650,000 opioid prescriptions are dispensed every single day. So these are still very heavily used in the US. Of those that are misusing opiates, it was found that the main motivator causing them to misuse was pain, which seems obvious, right? The first reason they went to get these was pain, right? But with how they were initially given out, with the fact that there wasn't a ceiling cap, there wasn't really any disciplinary action placed on doctors for prescribing these, it makes it really easy for people to get more opioids than they really need and then use more than they need and lead into misuse. If you get a bottle that says, if you're feeling pain, you can take this and it'll go away, you can bet if people are a little bit more sensitive to pain, they'll probably take more than they actually need. So that can lead down to the road of misuse. Misuse could go to addiction. Addiction can go to disorders, and a disorder can inevitably potentially lead to death. And it does in a lot of cases. There's over 30,000 overdose deaths per year based on 2015 data. I think I saw a study or some research that said in 2018 there was approximately 128 deaths every day because of opioid overdose. So it's serious impact still even to this day. These numbers quadrupled from 1999 to 2015. And again, this is likely due to the fact that there was a lot of overprescription because there was no ceiling cap placed and no disciplinary action placed. So people could just be given whatever quantity. Obviously, they weren't just handing out bucketfuls of opioids to people, but if they get more than they really need, then odds are they'll use more than they have to, or sometimes they have more than they need, they might give it away to somebody else, and that person will likely misuse it. That's just an idea of how this can possibly occur. A lot of negative things I just said about opiates, and again, you guys know opiates aren't really bad in and of themselves. They have a time and a place and a certain situation when they definitely should be used. Anybody want to tell me what that situation might be? Right? Surgeries. if I'm playing football with my friends, somebody tackles me, I get a tibia fracture, the bone sticking out my leg, I guarantee you I'm going to be screaming at people to give me these drugs right now. So they have a time and a place, and that's acute injuries or acute emergencies. But it's the long-term use where they're not really needed. That's where you can get these long-term side effects that come along with it, and that's what we're really trying to avoid. All right, so now you got an idea of how they impact society. Let's look at how chiropractic actually can impact this. So some key things, it's been found that low back pain is actually one of the most common reasons that people seek out prescription opiates, which seems very surprising when low back pain is kind of like our main thing, right? So this is obviously due to misinformation or just lack of awareness that chiropractic can help in these certain instances. So this is where it's very important to communicate chiropractic, talk to patients, let them know that there are alternatives. Chiropractic actually is very beneficial in this aspect. Another big thing is more than half of opioid users actually report having a history of back pain, right? Super ironic that they're going to get these drugs when they're going for things that we directly impact. This is directly what we're working on. Again, we're not trying to be pain doctors, but majority of the patients that are going to come to you are coming to you because they're in pain. And we got to make sure we're able to address that for them. Last big thing, back pain is actually responsible for about $100 billion a year in disability and social costs. So it's a very, very big impact. And it's kind of funny when certain patients will probably tell you, no, I'd see a chiropractor, but they're a little too expensive. Yet a lot of people will shell out money for these opioids to get themselves out of pain. So it all depends on what people are putting their value into. They're putting into these drugs or putting into chiropractic care. This is again where it's important to let people know that their health is an investment and not an expense. So let them know that it's important they invest in something that's going to help them both early and long term, which chiropractic care can do. Opioids has been shown to give you that whole laundry list that that mean girl didn't like, right? So we want to avoid that. So luckily there's a couple of different organizations that are kind of leading towards what our goal is, which is weeding people off of opiates and getting more into chiropractic care. American College of Physicians and the CDC actually recommend the use of non-pharmacological treatments. That includes exercise, physical therapy, massage therapy, acupuncture, and spinal manipulation. Most people don't like that word, adjusting, but that's directly us. So it's been acknowledged that chiropractic can help in these situations. One of the articles we looked at by Kazis and colleagues in 2019 stated that guidelines indicate that opioids should not be considered a treatment option for low back pain unless recommended treatments fail and if the benefits of opioid use outweigh the risks, right? So more and more, a lot of people are seeing that something needs to change and more people are recognizing chiropractic to be an option. So now I've told you that a lot of people are seeking chiropractic care. How much can chiropractic actually help with reducing opioid use? So one of the studies we looked at actually looked at directly that. They were looking at an association between the use of chiropractic care and a reduction in the use of opiates. So one of the ones we looked at was a systematic review meta-analysis. Essentially just means that they looked at a bunch of different studies and compiled it together. The study had 6 different articles they compared, and it was a total of, I think, 63,000 subjects in total with all those articles together. And overall, they found that there is a 64% lower chance of those people using opiates or lower prescriptions, those that are using opiates when they were under chiropractic care compared to those who were not under chiropractic care. Okay. One of the reasons there was only 6 articles was because the authors of that were trying to make sure that they only looked at articles that had chiropractors doing the adjusting, whereas there's a lot of articles out there that use PTs, osteopaths, other professions. One of the other big things was that they found that the chiropractic adjustment itself actually had clinical benefits that were they had benefits that were clinically significant in comparison to non-steroidal anti-inflammatory drugs. So same almost exact effect, but chiropractic adjustment came with none of the crazy side effects that you get with all these other drugs. So big benefit for people to make sure you let people know. So big thing that you can take away if you're getting too much, overall there's a negative association between chiropractic care and opiate use. So this is what you can tell your patients. If you're under chiropractic care, you're much, much less likely to need opiates to deal with your pain, right? Get excited. All right, now don't get intimidated. This is a table from one of the articles we looked at, so I'm going to walk you guys through this. Essentially, this is from an observational retrospective study. So essentially, they took a bunch of data from the past. They were looking at claims data for up to just over 200,000 patients, specifically those that had acute low back pain. What they did was essentially compare the amount of opiates prescribed by primary care physicians and compare that to all these other healthcare professionals. Reason these guys were, the comparing group was because they're the ones that are most commonly seen initially for pain, primary care physician, and they're also the ones that prescribe opiates the most. That being said, I don't want anybody to put a negative light on to primary care physicians in any sense. They're doing what they're trained to do. They're trying to help people out of pain. They don't have the same training in adjusting and other modalities that we do to help these people. Now, going back to this is for acute low back pain. So it's at least nice to know that chiropractors were the second most seen profession. Scary to see that orthopedic surgeons were the second most or third most seen profession, but that's another thing. So some of the key things to take away from this, there were 3 professions that were shown to have significant results in reducing the amount of opioids used, both early on and long term. Those 3 were, oh, whoopsie, wrong way. Those 3 were chiropractors, physical therapists, and acupuncturists. Right, they all had significant decrease. There was at least 73% reduction in the amount of opioids these people needed in comparison to those that saw a primary care physician. So we do have a big impact on that along with these other conservative professions. So working together is probably the best option in this scenario. Now, along with that, there's a couple of these professions that actually saw an increase in the amount of opioids needed long-term. So you can see orthopedic surgeons, MDs, rehab physicians, neurosurgeons, they initially had a decrease in the amount of opioids that were prescribed to their patients, and then it rose up long-term. The reason that the authors hypothesized this happened was because most people nowadays discouraged to be prescribing opiates to people. Like you can see, it's supposed to be a last resort thing, emergency situations. So they'll avoid it for the most part. But when patients come back, they have persistent pain that's not going away, and they don't know what else they can do about it. That's where they resort back to prescribing opiates, or at least that's what's hypothesized. Now, the U.S. Department of Health and Human Services has made 5 priorities for reducing the opioid epidemic. So these are the 5 priorities they put together. Improving access to treatment for recovery services, promoting the use of overdose reversing drugs. Seems kind of ironic to combat drugs by giving them more drugs, in my opinion. Next one was strengthening our understanding of the epidemic through better public health surveillance and providing support for cutting-edge research on pain and addiction. And lastly, at the bottom, advancing better practices for pain management. Now, they're not directly saying that that's chiropractic, but essentially this is where chiropractic fits in. We are that better practice for pain management in this population, being that the majority of them are actually seeking out opioids because of back pain. So this is where it's very important that we understand that we're going to play a major role in this. So, you feel like you can help her? You feel like after everything you guys have heard, you think you can help her either by just understanding where she's coming from now, why she's made the decisions, why she's taking these opioids, either educating her on what chiropractic is, how it can help in this scenario, the research behind it, inform her on how opioids impact the body, side effects that come with it, or take action and take a history on her, do an exam, see if she actually would benefit from chiropractic care. Do you guys do one or more of these? That's what I like to hear. So let's go back to what our goal was for this talk. Our goal was to help you understand the patient's perspective so you can see where they're coming from, why they made the decisions they made, so that you can help them and not judge them on their decisions. Know the social impact and economic burden so you can help them understand that. Educate yourself, your patients, friends, and family so they're more aware of what chiropractic can do, the research that it is beneficial, it can help these people. Inform them, inform everybody of the risks, the rewards, the research behind it, stats, side effects, safety, so that 1, you're well informed, 2, they're more well informed so that they can make the best decision for their health. Lastly, act, adjust the patient if you can, or if needed, refer them out if they're outside your scope, co-manage them with MD, PT, acupuncture, whoever it is that's going to best fit that patient, and love them. Just show simple compassion for that human being that's working with you and understand the struggles that they're going through and why they need to seek out anything to get them out of pain. So we want to leave you with a quote and a vision for this presentation. Imagine a world in which medicine was oriented towards healing rather than disease, where doctors believed in the natural healing capacity of the human being and emphasized prevention above treatment. In such a world, doctors and patients would be partners working towards the same ends. Right. This is what chiropractic is for. I hope you guys all feel more prepared and more confident that you guys can help lead this profession towards this. Thank you. Again, Thank you, everybody on the camera. Hope you enjoyed.
Thank you, Sir Peoples.